looking after yourself and your loved one after their sudden cardiac event. Hello and welcome to this video guide exploring how to look after yourself and your loved one following their cardiac event. My name is Caroline and I'm a cardiac rehabilitation clinical nurse specialist. This video is appropriate for any loved one or carer of someone who has experienced a cardiac event, particularly for those who may look after or live with that person. In this video, we will explore some of the feelings that you and your loved one may be experiencing, how to adapt to lifestyle changes, and what support is available for you. The information presented will include data from research, experiences from other cardiac patients, and sources of support. Overview. This video will cover the following topics: your experience so far, adapting to changes, changes in your loved one, coping with caring, and mindfulness. If you have any concerns about your loved one's heart condition, please encourage them to speak to their GP and cardiac team, as well as looking at the information on our Trust and British Heart Foundation websites. Your experience so far. Depending on the context of the cardiac event, you may have been highly involved or not involved at all. You may have been present at the time of the event and potentially involved in resuscitation or the early stages of hospitalization. If you were there at the time, it is normal for you to feel distressed, shocked, sad, or angry. You may be thinking a lot about not knowing what to do at the time or feel anxious that another event could happen in the future. These feelings can come and go as your loved one recovers, and it's normal for these feelings to fluctuate throughout recovery. However, the feelings usually improve in the initial weeks and months for most people. Alternatively, you may not have been there when the event occurred, and only heard about it when your loved one was in hospital. If this was the case, it can be very difficult and leave you feeling angry, sad, or guilty that you weren't there. It is normal to feel this way, and it could be helpful to talk to someone close to you about how you're feeling. Try and imagine what they would say to someone else in your position who was feeling the same way. Adapting to changes. Once your loved one is home from hospital, it will take some time to adjust to lifestyle changes that you and your loved one need to make. Your loved one may be more dependent on you as a result of their event. As well as the new tasks involved in recovery, you may have to pick up some of their responsibilities, particularly driving and household tasks. It may take time to adjust to having new responsibilities alongside your current ones, such as other caring roles or full-time work. You may feel unprepared or unsupported in making these changes, especially when you're already coping with difficult emotions around your loved one's cardiac event. However, even if you feel like you are too busy, it's important to put aside some time each day to focus on your own health and well-being and to reach out for support when you need it. We will cover some sources of support in further slides. Changes in your loved one. As well as lifestyle changes, your loved one may feel fatigued, weak, and struggle with day-to-day activities. These are all normal and will likely lead to a decrease in overall activity. For most people, these effects will improve in the first year, so it's important to be patient with recovery. You may also notice that your loved one struggles with concentrating and memory, and you may pick up on other changes in them. They will also be working through the impact of their cardiac event, and these changes are to be expected. As with physical symptoms, these should get better. If they persist past the first few months, encourage them to consult their GP for further investigation. For more information about some of the changes following a cardiac event, please look at the I Care About a Survivor page on the Sudden Cardiac Arrest UK website. Coping with caring. Just as it is important to care for your loved one following a cardiac event, it is important to care for your own needs too. It may feel difficult to address your feelings or issues, as it was not you who experienced the event. Remember that caring for yourself is not selfish, and it will benefit both you and the loved one you look after. If possible, try to reach out to friends and loved ones, talk your feelings and any issues through, and consider professional support if you are feeling overwhelmed. It is also beneficial to regularly reflect on how you're feeling and how caring is impacting you. If you would answer any of these questions on the screen as yes, you should contact either your GP or local carer service for further support. We will now hear what some of our other patients had to say about their experiences.
My name's Ian Clapp. I'm 70 years old. At the time, I happened to be snow skiing in Austria. I had just come down off the slopes and felt a really sharp pain. I thought, ooh, this doesn't feel right. I couldn't even make it as far as the hotel because I passed out at the bottom of the mountain. My wife was fortunately with me, and she called an ambulance. My son was also with us, and 3 little grandchildren, and my son's wife. We were all skiing at the same time. It was the first time that I'd taken them abroad. And so obviously it was quite a big thing for us to all do as a family. It was a bit of a shock when I had a heart attack on the very first day, on the very first time I was coming down the mountain. So the whole family were very supportive to me while I was going through the whole process. But I think my wife was probably more supportive than most, because I think it definitely is interesting how people react in different ways. When this happened, she almost didn't want to leave my side, but she obviously had to because of hospital rules. My wife had huge emotional struggles. She actually found it harder than me, although I was going through the whole heart attack process in the hospital. She found this really affected her. And she took quite a while, probably 3 months, to come through the whole journey of coming to terms with actually what had happened and how it would change her life as well. During the classes, I picked up leaflets which actually did help my wife because she could read out some of the helplines that were offered on the leaflets, and it was a great help to her.
I stayed with my daughter for a couple of weeks after I came out of the hospital. She was on it, as the younger ones say, and she was there if I needed anything. If I didn't understand anything that I was being told, she would speak to the person at the other end of the phone so that she could relate to me. Because there were a couple of things, because I did find it overwhelming at first with all what you being told, and I was like, I can't quite grasp all this. So she would take that. So she fully understands. She was fully in charge, if you like.
Did you have any loved ones in particular who really got involved?
My partner, yeah. Obviously, pretty scary experience for her as well. It's probably more so for the people around you than actually you going through it.
Was your partner there when it happened?
Yes.
Or? Yes.
Yeah, she went through the whole thing. Literally took me to hospital and went through the whole process. It just took a lot out of her, I think, because of the worry about what's happened, and obviously at a younger age as well. You don't know what's going to go forward.
So the worst thing you could do is just sit there and say, I'm not going to do anything, and I'm just going to stay in and not see anybody, because you're not moving, and you want the endorphins, and you want the time with people that you care about and love. And obviously the people that are around you who do care and love you are there to support you, and that's the biggest support network you've got. So you need to utilise it as much as possible. So I would say as much as my friends and families, and talk about the process I was going to go through, but also just talk about normal life as well, because that does carry on. Your life will just carry on. It doesn't just stop and that's it. So you need to stay positive as much as possible.
Nowadays you got your iPhone, and I talk on that, and it's just like sitting in the room. It's, you know what I mean? I put it down to my eldest daughter, because I've had lung cancer and that as well, just before having my heart attack. But she talked me through it. She's the one that reassured me, kept me alive, so I didn't give up that hope. Do you know what I mean? I had something to live for. I should imagine they were burdened, but they don't let me know that. And at the time, and still now, I ask them if everything's all right. I know she's around a decent set of people. It's because everyone's got burdens. Don't matter how marvellous you think you are, you're not. And it's accepting all that stuff and dealing with it as it comes along.
Mindfulness. Throughout the caring process, it's vital to treat yourself as compassionately as you would treat your loved one. It is common for us to be hard on ourselves when we notice we are having negative thoughts or feelings, but this can negatively impact on us in the long term. It can be helpful to imagine what we would say to someone else in our situation and to apply that thinking to ourselves. Try to remember that you're doing your best for your loved one and that you are making their recovery from the cardiac event easier. Mindfulness can be a useful practice to help you remain present and prevent you from being overwhelmed by negative thoughts and feelings. For further guidance on mindfulness and self-compassion, please access our Trust websites, where you can find guided mindfulness exercises. Looking after a loved one after a cardiac event can be challenging, and it's important to look after yourself during this time too. Reach out to loved ones for support and don't feel guilty for taking some time to focus on your own well-being. Remember that you are helping your loved one through this difficult time and that everything you do for them will make their recovery easier. A selection of further resources and support will be listed along with this video on our website.